Welcome back. This is Dr. Caxton, and I hope in giving you a summary, the virus, unlike a bacteria, cannot survive outside a host. It needs a host. Some animal, some human, hotel of something. And the coronavirus infects the type 2 lung cells that produce surfactant and gets inside the cell, uncovers its genetic material because it cannot reproduce by itself. It needs our own protein manufacturing factory to produce more of itself. And it does that successfully because the spike protein made of two parts has an S1 that attaches to a receptor, a keyhole in the lung cell called the ACE2 receptor. And once that S1 protein locks into the ACE, a change takes place in the spike protein, those things you see in those pictures, and then an S2 part of the spike protein allows the virus to form like a hairpin and fuse with the cell of the host, the hotel of something, the victim, the host. And then it goes right inside, releases its genetic material. That genetic material is lined up on the ribosome of the cell of the victim, and then from there begins to produce more of itself. And we said that when that production begins to take place, the virus particles are created, they're repackaged, sent back out, and the cell gets sick. It may die, it will be wiped out if the immune system is great. And the more of the virus that's produced, the more likely an irritation will occur that can lead to dry cough, eventually fever, and all the other things that can happen, like shortness of breath, cough. But it starts gradually. And during that process, as you develop fever, body aches, and eventually cough, shortness of breath, your body is getting inflammation. And that inflammation is due to the presence of the virus, the irritation caused by the dying sick cells that are produced, the virus itself, the attack by your own natural killer cells of those sick cells and attempts to fight the virus. It's a battle, and it's a bloody battle in the sense that a lot of chemicals are released, and we call those chemicals cytokines. And those cytokines in turn affect not just your lungs, but everywhere: your liver, your kidney, your lungs, the brain, the joints, and the heart. Every single organ pretty much is affected by those cytokines. And I call them the hangman of COVID-19. Eventually, based on cytokine levels, when they're measured, it may indicate that the person has a very high likelihood of dying. Now, to close that part up, there are three phases that happen. The first is the virus multiplication phase. We already see, as you can attest to right now, that because of the presence of the virus, as the fight is going on with the normal cells and the abnormal cells, they attack one another, and that itself releases cytokines and inflammation. So the second phase is the inflammatory stage. We now go to the third stage, which is the thrombotic phase. You see, cytokines can trigger blood clotting. Okay, the spike protein on the virus can also trigger blood clotting. The spike protein can damage the lining of the blood cells, has been shown by the Salk Institute. And so in the process of all this, from the viral replication phase to the inflammatory phase to the third phase, the thrombotic phase, a whole lot of damage occurs in the body that can lead to acute respiratory distress syndrome, kidney failure, liver failure, abnormally beating heart, and multi-organ failure that eventually leads to what? Placing a patient on life support on the ventilator, and eventually they may die. Now, there are some things that need to be considered when a patient is immediately diagnosed before they get so sick that they have to be hospitalized. And we know at this point that about 85% of the people, particularly in the middle age and younger, will survive. A lot more will survive. And I'm going to show you the next numbers. But if you've not registered, this is the time for you to register, because we're going to go into the real fun of what's happening and why we still have COVID-19 today. Several questions are going to be answered. One of them is, how long have we known about COVID-19? How long have we known that it is a dangerous virus that is SARS-CoV-2? Are there really no drugs that we already have that can be repurposed to treat? And most people are curious. As a frontline doctor in the emergency room and in the hospital, did I panic or run out of fear when COVID hit the shores of the United States? Now, the fourth thing I'm going to answer is, were there any clinical trials that could have been helpful in stopping this virus before it killed over 700,000 people in the United States? Well, guess what? Now, this other question is important. Did a lot of treating doctors study the clinical trials on drugs like hydroxychloroquine or ivermectin, or did they just watch the news and follow the brainwashing techniques of the mass media? That's an important question. You're going to be able to decide on your own by the time you finish this course. What's evidence-based medicine? I'm sure some of you have heard evidence-based medicine, evidence-based medicine. We're going to look at that in the rest of the course. I'm also going to show you a picture of what ivermectin looks like, as well as chloroquine. Out of curiosity, some people want to know how those drugs look like. Well, you're going to see that if you sign up and you follow. You'll see that. Exactly. Now, the third thing is, when vaccines are given as boosters, what does that do? What is the likelihood that you can give yourself what's called antigen overload? That's what we call it in science, an antigen overload. What can that do? You should be curious. And lastly, we're going to talk about long haulers. I don't want to talk too much about anything else at this point, except to tell you that you've got to decide on your own, with all the evidence, that the clinical trials that were recently published by Steven Gazet et al. In Israel showed some astonishing facts about the vaccinated compared to the unvaccinated who had been infected with COVID-19. You would want to know what those studies show and why it's important when you're making corporate policies in the human resources department, because at the end of the day, doctors may get a lot of lawsuits. Pharmacists who are refusing to fill prescriptions, they're not even used to being sued. They may end up with lawsuits. If you're a business and you did not understand the science of what's been described in this online course, you may hang yourself dry. And we don't want that to happen. We want people to have informed knowledge based on the scientific evidence. Not only that, to make policies that protect not just the business, but the employees, knowing fully well that if you do not know what to do, what to tell your employees, you just might not only lose those employees, you might have lawsuits on your hands that destroy the business itself financially. And so my goal is to make sure that doesn't happen. And at the end of this, you'd be able to answer at least 3 questions. Number 1, what can I do, regardless of who I am, whether you're a church pastor, a CEO, whatever you are. Thank you.